You know, I was diagnosed as a blind pickup, and blind pickup is when you have no symptoms, there were no issues. I was just going in for my annual exam, and my physician felt something unusual under my rib cage. Didn't think much of it, and so I learned to start working with trusted medical resources, doctors that I trusted, people in the field that I could talk to and could lead me to make better decisions.
What I try to say in the very beginning is we're on that journey together. You know, they're the reason why we do everything we do every day, that we're trying to keep this cancer controlled for as long as we can. Cure is always on the mind, and that's ultimately our goal.
I think what happens a lot, especially with the newly diagnosed, is that you're panicked. We want to do something immediately, and we may not think through all of our options or even know what all of our options could be.
So one of my first take-homes is especially for patients who may have a metastatic stage, who have a well-differentiated or slow-growing NET. I'll say, think of this as a chronic disease, like you would your diabetes or high blood pressure. This is something we can control, have a great chance of controlling for many years. So then a sigh of relief. The second point, really important take-home point, is that I try to leave them with, we have lots of tools in our toolbox. And I think that that's a really great way to relieve them.
One of the things that I recommend to patients is that they write down what it is that they want to ask their doctors before they go to their appointment, so that in fact, when they get to their appointment, the nervousness of being at an appointment and listening to all sorts of things won't confuse them and won't stop them from asking the questions that they want to have answered.
This is a condition where we think about patients individually. Every patient really is unique. So I think we try to learn as much as we can from other specialties, to bring all of the specialties together to help us think about each person and come up with a unique treatment plan.
And I also tell them a little bit about the long-term follow-up of these patients, because many of these patients with some of the slow-growing tumors, they can live for 20, 30 years.
And even now, 10 years later, I still use the time when I'm not progressing or when I'm feeling fine, to use that to really educate myself about what might be next for me. But not to panic over it and not to spend my whole day scouring the internet, because it really doesn't change.
I think it's very important to support the patients with that they can live with the tumor, they can have a fairly good life, even if they had widespread disease.